Senator from Clarendon, what purpose do you want?
Thank you, Mr. President. I want to see if the senator will yield for a few questions.
Senator Yielson,
At
question.
some point, I plan to speak on this bill, but I did have a few questions. And I will just preface my remarks by saying, I guess I'll say, did you know? But years ago, when we had the debate on the cannabis oil that apparently helped a lot of, especially children, with seizures, did you know that I did vote for that bill? If not, I'll just remind you that I did. But Senator, there's been a lot of talk about that we've been at this for 7 years, right? 7 years. And I think you will agree that I have commended you a couple of times on the work that you have done, although I still stand against the bill, on the work that you have done with this bill from the first time we started debating this bill up until now. And did you know that I tell people every day that although I'm against this bill, still remain against it, the bill before us today is a far better bill than what we started with back when I was on the subcommittee with you. I somehow got taken off the subcommittee. But the question I have is, because it has been 7 years, and I was just sitting here thinking, that's a lot of time. And in those 7 years, am I right that the Food and Drug Administration has done nothing to reschedule this bill so that it can be a legal medicine for people in need for it? Am I right about that?
It's not been rescheduled.
Okay, in 7 years, has anything been done to allow physicians to write prescriptions for medical marijuana?
At the federal level,
Right.
Not at the federal level.
And then in 7 years,
Let me rephrase that. I think that there has been federal action because, again, every year in the budget and also in the in the continuing resolutions, there is an express prohibition against the Department of Justice challenging states that have passed medical cannabis laws. So that, in a way, is a green light to states to pass these laws, which in turn empower physicians. So yes, there has been federal action.
I accept that, but I think what I'm asking is, after all of this time and all this work that has been done, physicians still cannot write a prescription for marijuana. And
what they can do in states that have adopted medical cannabis laws is they write out written authorizations. It's not called a prescription. It's a written authorization. Right. And I'm going to go into in a minute, what has to precede that authorization and the degree of diligence a physician has to employ. But you're right, not prescription in the sense that FDA
in the sense, right, in the sense that I take a lot of medication, right, and I can go to my doctor and get refills. He can write prescriptions, and I can take it to the pharmacist. That's not the case, is it, for medical marijuana or for marijuana? I'll put it that way.
I think it's the case, and the senator from Charleston was saying there are some states that do have pharmacies and pharmacists that dispense.
I guess I meant to say in South Carolina. I'm sorry.
No, in South Carolina.
And so, is it also true that after all this work for 7 years, pharmacists can still not dispense marijuana? Is that right?
In South Carolina?
In South Carolina.
No, in South Carolina they cannot.
And then I heard your, and I think I was on the committee when the young lady spoke, and I'm compassionate, I really am. And I would just say, for the record, to the body, did you know that I've never tried marijuana, don't know what it feels like, I don't like the way it smells, but I'm just concerned because, did you know when I was on the subcommittee, and even after then, there's been all type of studies and data and statistics, some in favor of medical marijuana, as you alluded to, and I'm sure you will give us some more, but there have also been some of the same type of information, studies, data, research, whatever, that has spoken against. And I heard your remarks earlier about people driving on the highway having had marijuana, and I'm going to find it before I go to the podium, but did you know that I have some information that shows that people out on the highways and roads under the influence of marijuana have caused a great deal of damage in South Carolina? I wanted to know if you were aware of that.
No, I mean, it's not my argument that people who are under the influence of marijuana can't be involved in traffic accidents. My argument is against what the South Carolina Republican Party circulated out there, saying that they would go up if medical marijuana was legalized, that the incidence would go up. And in fact, I'll go into that right now since you're bringing it up. But it turns out that they go down, okay? And empirically, there's 3 or 4 different studies, including one by the federal government, that shows that traffic accidents and fatalities go down in medical marijuana states because alcohol and marijuana are substitute goods, or substitute, in economics, you've heard of substitute or complementary goods. It's a substitute good. And you can see a marked decrease in fatalities in cases that have medical cannabis laws. I mean, so I'm not saying they can't be in accidents, but I'm saying that on the whole, the statement that it's going to spike isn't borne out by the data.
Okay, I only asked that, did you know, because I was in Charlotte over Thanksgiving weekend, did you know, and I got rear-ended. And I jumped out of my truck and I uttered some words that my family never heard me utter. And when I got out the truck to see what the problem was, there was a strong odor of marijuana coming from the young lady's car that ran in the back of me. And I really believe that contributed to that accident. But the other question I wanted to ask, because I heard you mention about SLED, and I will say I have spoken to SLED a number of times about this bill because I share some of their concerns. But I just wanted to ask because I don't know, and I know SLED has been very forthcoming and truthful to me and those types of things. And, you know, at one time, earlier version of this bill, it allowed for, I guess we would call a smokable version of marijuana. So I'm just wondering, was that when SLED was going around the state saying and talking about smoking marijuana, or was it after you took that out? I'm asking that question just out of curiosity.
I met with him. I met with Chief Keel and also with representatives from SLED over time. At what point in the process did it come out? I don't know.
Okay.
I want to say a couple years ago, but it got taken out. I guess my point is because that's something they said. Look, we don't want this, and I'm like, okay. I mean, I want to come up with a bill here that's reflective of concerns, and I hear what you're saying. That individuals who are smoking a joint, okay, they want to be able, when they see that, to immediately infer that it's illegal. And if you're allowed to burn leaf recreationally, they wouldn't be able to make that determination visually, right? So they wanted that taken out. And quite frankly, a lot of the advocates and the people that have been put were angry about it getting taken out. But my point has always been, this isn't going to be Colorado or Washington. It's going to be South Carolina's bill. And it's going to be, and it is a lot more tightly regulated and conservative than even the one Mississippi's about to pass. But that's okay because that's what I told this body I was going to come up with. And there's going to be a part of my presentation where I talk about all the concessions that we've made.
Yeah, and I agree. And again, I admit that there have been a lot of concessions that were made. And I would go so far as to say, did you know that a lot of folks who have been contacting me over the years in favor of this bill are going to be very upset when they realize what the bill entails now, because a lot of the folks that contacted me, just to be completely honest, did you know, they saw this bill as a way to get marijuana they could just sit around and smoke and get high on all day, and not knowing that, and still probably don't know we're talking about oils and creams and those types of things. So they're going to be upset when they realize all of the enhancements that you have made to the bill, and they can't just sit around and get marijuana and smoke it. But you made and I do feel for people who have issues. I've been suffering with some excruciating back pains for the last couple of years. I'm getting injections. I'm taking the pills. And I made a joke, and it was just a joke, did you know, to Senator Huddle one time. And I said, you know, if I thought it would help my back, I'd try some medical marijuana. But that was just a joke. I wouldn't do that. But you made a...
Well, let me stop you for a minute and ask you this. Would you agree that it isn't the moral thing to do to help somebody like Margaret Richardson to safely and legally access something that clearly can help her? Don't you think that it's our job to come up with a way to make that a reality?
Let me answer the question this way. It's a good question, and you made a good point, and I am compassionate, and I know people who suffer pain and those types of things. And you gave an example of if I had a loved one, for example, that was laying in bed, sick, in pain, whatever, and there was something that I could get, even if it was illegal, to help them, to ease their situation. And I thought about that, did you know? And I thought about one person in particular that I happen to know. It's actually in prison right now. And it wasn't pain or medical marijuana, but they did have family members who were sick. They were hungry. They probably didn't have a lot of the necessities in life. And they were desperate. And so they did probably what maybe the average person would do, and they committed a crime to provide for their family. And while I can empathize with that, this may be comparing apples to oranges, but I mean some of that happens in other instances. I just can't advocate that a person will commit a crime.
But in that instance, Senator, you're talking about a crime against taking the property of somebody else. In the example I gave, the crime you're talking about is the state's absence of a law that allows a physician to have access. But my point was, and I won't speak for you, I'll speak for myself. If I had a daughter that was screaming in pain, no pharmaceuticals could mitigate that pain, and there was marijuana there that would get rid of that pain like that, like it does for Margaret, you're damn right I'd give it to her.
And you know what, Senator, did you know that I probably would too? But it would bother me, did you know, because it would still be illegal, but I understand that.
But I'm trying to make it easier for you now by making it illegal.
But the other thing is, because we're talking about trying to do things to help people, and you know, I mentioned, do you remember when we debated the certificate of need bill?
I'm at Medicaid.
No, I'm getting to that in a second. I'm going to take my seat. But the certificate of need bill, and I said one of the things that formed my opinion were two things. We're talking to my hospital officials back home and other hospital administrators in rural communities. But it bothered me that the South Carolina Medical Association also came out against the bill, and I'm wondering who in here, and there may be some, but who in here knows more about what's important for hospitals, particularly in rural areas, than the South Carolina Medical Association. And so now here I am now, we're debating medical marijuana, and I'm listening, did you know, to 4 or 5 friends of mine who are healthcare professionals that I have a lot of respect for, and they've given me some horror stories about medical marijuana. I may share some later on. I'm listening to sheriffs in the counties I represent and other counties throughout South Carolina. I'm listening to police chiefs, and I'm listening to other folks who I think would have SLED, law enforcement, more of an understanding, I'll just speak for me, than I do as far as medical marijuana is a good thing or not. But I'm going to close because you brought it up, but I was going to bring it up anyway. The other question I have...
Before we move on to that, let me respond. I tell you who does know more. That physician sitting down with that patient, examining that patient, reviewing that patient's medical history, looking at whether or not pharmaceuticals have helped, that relationship is the one we ought to be exalting. That relationship knows best. Are you trying to, I don't think you're trying to say that SLED and law enforcement knows more about what's in that patient's best interest than a physician sitting there and counseling with that patient? Are you saying that sheriffs know more?
I grant you that, but you're making my argument now that I'm going to make when we start debating abortion again about who knows best what's good for that person sitting around that kitchen table. So I grant you that. But I'm not going to try to be a broken record on Medicaid expansion, but I said it during Certificate of Need. I've said it every time we have talked about medical marijuana. And I still believe, did you know that if we really want to help people who have health care issues in South Carolina, that we ought to expand Medicaid. Now, you mentioned about not let South Carolina be the last state to adopt a medical marijuana law, but I think we're only one or 2 states that have not expanded Medicaid. And I'm telling you, I live with these folks. I see them in my community. Did you know? They're not looking for a handout. They work. We can't raise the minimum wage. They make minimum wage or a little bit more. Some of their jobs, did you know, don't offer health insurance. Some that do, they can't afford it. And the last I checked, we can immediately help improve the life of 200 to 300 South Carolinians if we expand Medicaid. And what kind of concerns me, did you know, is that most of the folks who are for repealing certificate of need, and that's fine, that's a done deal, and that's good, had some amendments to make the bill better. But then, and then most of the people who want people to have access to marijuana to help them health-wise, I can't even get a hearing to give people Medicaid. And it's just, it baffles me, so I feel like, did you know, as I take my seat, if I'm for repealing CON, and if I'm for medical marijuana, I should be for Medicaid expansion. There are a lot of benefits to individuals and to the state of South Carolina to expand Medicaid, and I still submit to you, Senator, as I applaud all your great work in this area, that the bill that helps people health-wise in South Carolina more than any bill that I've addressed since I was in the Senate, which has not been long, 10 years, is Medicaid expansion. And I can't even get a hearing on the bill.
Let me make this commitment to you, and I think I made it to you during the CON. When it comes to health care, there are two sides of the equation. You've got supply and demand. CON was talking about supply. You're right to say that's half the equation. We ought to look at the demand side. And if there are people who are unable, don't qualify for Medicaid, or can't get insurance through the exchange, a so-called pocket that's in there, I am open up to ways to empower them so that they can access health care. Where I would differ with you slightly is I don't think expanding Medicaid is the most efficient way to get there. But I agree with you in principle that if there are people that don't have access to health care, we ought to figure out who they are and how best to help them. And I'll join you in having that debate. I want to have that debate. I don't want people to go without health care. I mean, I don't.
And I know that, and I appreciate that. But did you know I keep raising that point because a lot of bills that are debated here, a lot of the argument for this bill or that bill is what other states have done. And I'm saying, again, are you aware that I think there's only 2 states left that have not expanded Medicaid? And also, did you know that as far as medical marijuana, I think there's like 12 or 13 states that have not passed a medical marijuana bill. And did you also know that most of the states in the Southeast, particularly we always compare ourselves to Georgia and North Carolina, have not passed a medical marijuana bill?
I think we're better than that.
Okay.
I think, and since you asked some good questions, and you got me thinking about the doctor-patient relationship, okay, and about what this bill does more than anything else. It exalts that relationship, okay? It is unlike any other state bill that legalizes medical cannabis. This has got such an emphasis on the physician, such an emphasis on that inpatient diagnosis, makes them go through a litany of things. First, you have to, it's almost like the right to try legislation, Senator Johnson. There has to be a finding by that doctor that the patient has not responded through pharmaceuticals. I mean, so it's again, it is very, very tight. And ironically, just a few months ago, the South Carolina Republican Party was railing against the CDC or the FDA or Anthony Fauci, saying they can't tell doctors what they can give these patients. That doctor does it in that patient's best interest. So if they want to give them, ivermectin, or if they want to give them some other therapeutic, that's between that doctor and that patient. Now I'm hearing that even if a physician wants to do it, oh no, it's cannabis, it's marijuana. We can't allow that. I mean, to me, that's not intellectually consistent. It just isn't.